that maybe this kid could swallow pills, and in fact they can't. Okay, so that's a good, just a real world thought there. If you have a pediatric patient, make sure you're talking with parents to make sure that they're able to swallow the pills if it is in pill form. It says there, liquid medications are easier to swallow and more quickly absorbed than solid forms. They are available in a variety of compositions. Some examples are Alka-Seltzer. You got, let's see, trying to think. There, pretty much any medication can come in liquid form. There's liquid morphine. There's Alka-Seltzer, milk of magnesia. Sometimes like antacids can come in liquid form. Okay, there's a lot of different types of liquid medications out there. Another form of liquid medication is an elixir, okay, and it's named because it contains alcohol in the preparation. The alcohol helps to dissolve the medication and make it more palatable. Dimetapp elixir used for colds is an example, okay, so that grapey flavored Dimetapp, it has some form of alcohol in it, okay, so if you are taking a cold medication, be very mindful about the alcohol content. Make sure that you're looking at that, right? Another thing is maybe you have a patient that is going through AA. Maybe they're being sober, right? Do you think they really need to be on a medication that has alcohol in it? No. So these are things that we really need to consider and look into. If you look on page 161, it says elixirs should not be given to children or to anyone suffering from alcoholism or diabetes. The liver converts alcohol to sugar. So like I said before, alcoholics, no to the elixir. Children, obviously we don't want to give alcohol-based medication to children. And then when it comes to diabetes, alcohol can affect the liver, which affects your breakdown of sugars, and so if you are a diabetic, it could really raise your sugars to the roof. Okay. It talks a little bit kind of towards the middle of the page. It says, conversely, suspensions are medications dispersed in a liquid, but because the medication may not have been evenly distributed, it must be shaken before it is administered. Read the directions to help you tell the difference. Additionally, a suspension separates into different layers of liquid. Thus, the misdistribution of medication. An example of a suspension that must be shaken before administration is Pepto-Bismol, which is used for stomach discomfort. Okay, so it's talking about with most oral medications, you need to make sure that you're shaking it up before you administer it. Why? Think about salad dressing. If you put oil and vinegar, what does it automatically do? They separate. Okay, same with, that doesn't make sense, but it's the same with these liquid medications, okay? There's different components that create this medication, and we want to make sure that they're all mixed together, okay? So if you have a liquid med, such as Pepto-Bismol, you want to make sure you're giving it a good shake before you administer it, because you want to make sure that they're getting all of the components that are in the medication. Syrups are medications added to highly sweetened liquids, and they are popular with children. Robitussin cough syrup is an example. I don't know about you all, but I remember when I was a kid and I hated Robitussin. I still have flashbacks. I also hated children's chewable Tylenol, the grape flavor. It just makes me gag just thinking about it as a child. But they nowadays, I wish I was a kid now, because nowadays, even like Walgreens, CVS, they have different flavors they can offer children. If you are a parent and you go to these places and they are getting like an antibiotic or something, the pharmacist might suggest like, hey, we got bubble gum and lime and cherry. What do you think your child would prefer? Okay, so the kids have so many more options than we had back in the day, but they do add syrups to these medications, especially for the kiddos, because let's face it, if we have to swallow these meds, we want them to taste at least semi-decent. If the patient is a small child or has trouble swallowing a liquid medication, so not only are they having issues with tablets and capsules, they can't swallow solids, they're having difficulty swallowing liquids, and yes, that can happen. The medication can be drawn up into a syringe without a needle. We're not injecting like Pepto-Bismol or anything like that into a patient, and slowly inject and gently into the buccal pouch, which is your cheek. Okay. This helps to prevent aspiration if the medication were injected directly toward the back of the throat. So essentially what you're doing is taking the syringe and you're slightly putting it into the cheek right here, right between your gum and your cheek, okay, that little area. And you're slowly releasing it. Now, in an ideal situation, your patient is not fighting you on this and you're able to just administer it quickly, okay? But it can take time if you have a patient that just doesn't want to take this medication. But you have to do it that way. You cannot just stick the syringe right in the middle of someone's mouth and just inject it in. I know if you're struggling to get it into the patient, you might want to do that. However, what's going to happen is they're going to choke, okay? Because it's instantly falling in the back of their throat. They weren't ready for it. And then that can accidentally go into their lungs and cause a way worse infection. All right, if you look at page 163, we're going to talk a little bit about sublingual medications and rectal medications, okay? So sublingual medications means under the tongue, okay? There's like a bazillion capillaries under the tongue that provide a rich blood supply for quick absorption of a medication. That's why if you ever bit your tongue, do you ever notice it bleeds like suddenly? That's because there's tons of capillaries in there. For that reason, a medication such as nitroglycerin is widely used as sublingual, okay? And so if you have someone that comes into the clinic and they're complaining of chest pain and your physician comes out and they're like, hey, this person needs nitro, and you go to grab the nitro pill, you're going to grab it, stick it under their tongue, okay? Don't have them swallow it. They just need to stick it under the tongue and it dissolves, okay? And it's instant relief because it's going through all those capillaries. It's getting into the bloodstream instantly. Nitro, which improves heart function, is placed sublingually for immediate relief of chest pain or during a heart attack. Although slower than an injection into the vein, the sublingual route delivers medication quickly without having to pass completely through the digestive system. So it's literally going under the tongue, through the capillaries, into the bloodstream. Whereas if I just had them swallow the nitro, it has to go through their stomach, through the large and small intestine. It has to be absorbed, and that takes too much time, especially with someone having a potential heart attack, right? Because time is of the essence when it comes to that. The next one we're going to talk about is rectal route, okay? And let's face it, nobody likes the rectal administration, okay? But sometimes it just has to be done. So some medications, such as suppositories, enemas, suspensions, or ointments, must be administered rectally. This route is sometimes necessary because the patient might have severe nausea or vomiting or is not alert enough to swallow, okay? I'm going to be honest, for medical assistants, you guys are going to be in clinic type settings, so I hope that your patients are alert. If they're not alert, typically that's in more of a hospital setting. But with the nausea and vomiting, okay, let's think about this for a minute. We have a patient that is having extreme nausea and vomiting, which means every time, even if they take a sip of water, they're immediately expelling it back out. Okay, so do you think if someone takes a capsule or a tablet for a medication, is it going to get into their system at all if they immediately vomit it right back out? No. Okay, so in extreme cases, because like I said, rectal is not exactly the first thing that we prefer to do for medication administration. If they're experiencing these type of symptoms, however, we are going to want to administer like maybe an anti-nausea medication rectally. Why? Because the reason that is not, some medications do not come in perinatal form, or the patient may not have an IV access. Sometimes patients are like, well, why can't you just inject me or give me an IV? Don't give it to me rectally, okay? But sometimes that's just not the option, okay? It's the safer route to go. Many medications such as Tylenol, Phenergan, which is for nausea, are available in suppositories. They have glycerin or cocoa butter base containing the medication. Because suppositories soften when warm to release the medication, they must be kept cool before administration. So they typically are kept in the fridge or in a cool place because we don't want them to melt, okay? If they melt before administration in the rectum, then we're certainly not going to give the patient all the medicine that they need. Another thing I want to talk about, it's in bold letters on page 164, is enemas. Okay, enemas used to be really big back in the 60s and 70s. Now enemas are only used in worst case situations. Why? Because they can severely dehydrate patients. Enemas are liquids administered through the rectum to soften stool, cleanse bowels, or deliver medication. Enemas are rarely given in ambulatory settings, so in clinics, they're not really used a lot. But many patients must administer them at home as a preparation for bowel procedures or surgery, or as a treatment for constipation. For these reasons, patients must be taught how to use them. To administer a rectal suppository or enema, follow the instructions in the procedure box 9-4. So if you look down at procedure box 9-4, we'll just quickly go over that. So it says, this procedure can be used for rectal suppository or an enema. So you observe the 7 rites of medication administration. You read and reread and compare the medication order. You wash your hands. You compare the medication order with the container for a second time. Okay? Check the expiration date. Nobody want to be given expired medicine. Identify the patient and explain what you will be doing, right? Because that's crucial. We don't want to just automatically perform a rectal suppository or enema on a patient if they're not knowing what's happening. Okay, compare the order and the container a third time, okay? Third time's charm. Have the patient remove his or her underwear. Assist the patient to lie on their side, okay? Place waterproof sheeting under the patient because obviously there's going to be a mess involved. Drape the patient for privacy. Put on gloves, okay? Open the suppository wrapping. Gently separate the patient's buttocks. Apply a water-based lubricant to the tip of the enema bottle or suppository. You don't want to go in dry because you could harm and cause pain for your patient. Insert the suppository with one finger into the patient's rectum, or insert the tip of the enema bottle past the anal sphincter and squeeze contents slowly being the key word there, into the rectum. Remove your finger or the tip of the bottle, assess the patient, make sure they're doing okay, that they're not in any harm or they're not in any pain or discomfort. Ask the patient to lie still for approximately 30 minutes because we want it to get working, right? Clean the patient and the patient's area, remove gloves, wash hands, and then document medication dosage and the patient's response to the enema or the suppository. And that, my friends, in a nutshell, is Pharmacology Chapter 9. I hope you all enjoyed my lecture for today. Until next time, have a good night.